Good afternoon, everybody. Welcome to Office Hours, April. Can't believe we're already pushing on May, but happy April, everybody. And I just want to make sure everybody can hear me okay. If someone could just let me know.
We can hear you.
All right, thank you. And then we have the chat function. And then can we also see the slide deck that's up?
WebEx. Enter your access code or meeting number.
Everybody can see the slide deck okay as well?
Yes.
Yes.
All right, thank you. Great. Well, as always, this is being recorded and we'll have it up on our training page in the near future. If anybody has questions along the way, feel free to ask or throw something in the chat, and we'll be happy to talk through and answer as best we can. So I am letting a bunch of people in right now. For some reason, this particular WebEx is making me let folks in, so I must have did something different when I set it up. But so I apologize as I'm trying to concentrate on that as well. But we have probably a shorter office hours today. We've had a bunch of long ones the last handful of months, so it's probably a little refreshing for folks to know that this won't be as long today. So we will get started. So today we're going to have a new provider update, policy and procedure updates, children's updates, quality management performance, touch on a public health emergency, and then the proposed executive budget, and open up for any kind of discussion anybody has along the way. But I just wanted to, I have this up the last couple months, but we officially have Shelters of Saratoga now up and running as a care management organization in our network. So I just want to congratulate them. And I think Stephanie actually joined. I think I saw her pop on here. So welcome, Shelters of Saratoga. They're focusing on Saratoga County and working with the adult population. So we look forward to working with you. So yay, shelters.
Hey.
Policy and procedure, Jessica, do you want to take that?
Hello. Today we just have one update for policy and procedure, and that's our continuity of care and reengagement. So our DSE policy, and no upcoming policies. So we updated our continuity of care and reengagement policy. It was an annual update, so there wasn't really any update to the actual policy information. One thing we did do is kind of pull the content out of the policy and created a new attachment that provides a crosswalk of activities for each month that a member is in diligent search. Go to the next slide. So this is a screenshot of kind of what that crosswalk will look like in that new attachment. It goes through month by month of diligent search, what kind of activities you can do and what that month means for diligent search. So on the left-hand side, you can see month one, and on the right-hand side, it kind of shows activities. So month one is going to be the month that the member has been deemed for diligent search. So nearing the end of the month, you're going to place that member in diligent search because throughout that month, you have not been successful in locating and engaging that member in Health Home. So you want to make sure that you're completing that contact note that moves that person to diligent search. It'll revert them back to that status for the first of the month. You're going to want to make sure that you're completing 3 separate search activities on 3 different days, and then you're going to mark all 3 of those notes as billable. If you are lucky enough to re-engage that member by the end of that month, you're going to go ahead and complete a contact note that's going to put them back into enrolled and bill. If the member is not found, you're going to bill still because you did those 3 billable activities on 3 different days. And then you're going to move to month 2. And then in month 2, you're going to repeat what you did in month 1. You're going to complete 3 separate activities. Searchable activities, which there are some examples in the policy. You're going to write 3 separate notes. You're going to mark them billable. You're going to bill at the end of the month because you have attempted to re-engage that person and move to month 3. If you did re-engage that person back in health home, you're going to bill, and then you're going to do that contact note to flip them back into enrolled. Go to the next slide. And then in month 3, you're going to do the same thing, 3 different activities on 3 different days, all documented in 3 billable notes. If the member is not found, you're going to bill, and then you're going to follow the health home disenrollment policy. If the member is found, you're going to put them back into an enrolled status. If you do not find the member by the last day of the 3rd month, the system will automatically disenroll them. And then you're going to follow the health home disenrollment policy. So basically what we kind of did is summarize the content of DSE and DSE activities into a little crosswalk. So hopefully this will be helpful for everybody. Does anybody have any questions on this policy or policy in general?
Yeah, I have a question. Do you still have to engage them for all 3 months, or can you cut it off after 1 month or 2 months?
So what you're going to want to do is it's going to be case dependent. You're going to want to look at, do you find them and they're in an excluded setting? Do you find them and they have moved to another county? Is it part of their normal pattern of behavior? So in some instances, you'll end diligent search because circumstantially something has changed. And in some instances, you will carry out for all 3 months. So there's no hard and fast rule because it really is case specific.
Good question. Any other questions around that?
I have a question, Jess. This is Tanya from White House. At the end of the 3rd month, if you still are not able to get any contact with the member or parents of any sort, are we still meant to send out a letter 10 days prior to the end of the month just so that they have an option to appeal the disenrollment?
Yeah, so when we are disenrolling someone due to diligent search, you're going to use that 5235 always with diligent search, because you're not ever sending just that letter, because you have to show that you don't have contact with the member. So the 5235 needs to be issued 10 days prior to the end of the segment. So on the 20th, the 21st of that 3rd month, you're going to mail the 5235, give them notice that they're being disenrolled. There is a checkbox that you check on the 5235 that says that you're being disenrolled due to lack of engagement. If they then receive that letter and choose to call you and re-engage, you can do that, and you wouldn't complete the disenrollment. You'd put them back in enrolled. But if they do not respond to that letter, then you would disenroll, the system would disenroll them, and then you would complete the rest of the paperwork and documentation to send out to the member.
Okay, thank you.
Yep.
All right. Any other policy questions? All right, Jessica, we're on the program updates for children's.
All right, me again. So I just want to thank everybody for their cooperation in scheduling those one-on-one meetings with me to review our HCBS cases. It's just easier, I think, if we all just kind of get together and meet one-on-one just to review our upcoming audit and the cases for that, rather than going back and forth via email. So I do appreciate everyone promptly scheduling those with me. We do have an update on the HCBS referrals and IRAMs. As you know, there is a feature being built out in IRAMs that'll allow us to electronically send referrals for HCBS. However, there has been a delay in that. It was supposed to go live for 1. It has not gone live yet, but I will keep you guys posted on when that happens. Just a reminder that there have been 2 webinars that the Department of Health has hosted. They were addressing some clarification with our target populations of SED and Med F. There were no changes to policy. It was really just clarifying existing policy. They did repeat the SED webinar yesterday. If you were not able to attend or if you have any questions, please let me know. I can send out what information they sent to me. I do believe they sent it to everybody, but if you didn't get it or if you'd like to have it, I can forward that along. And lastly, there have been 2 CAN sessions scheduled. These are going to be for the group training and group coaching. It's going to be hosted by the CANS Institute. I sent the invites out for May 2nd and May 9th from 9 to 11. You only need to attend one of those sessions. And once the CANS Institute sends me the link for Zoom, I will update the invite for that. So keep an eye out for an updated invite that includes the link to attend via Zoom. Does anyone have any questions on children's updates? Okay, perfect. If you need anything, you know where to find me.
Thanks, Jessica. So just a couple quick updates that I want to touch on with everybody. So United Healthcare reached out to the health home about a month ago for their members that are affiliated with UHC, and they're asking for HCBS service for HARP when that discussion was had last with those members for HCBS if they're a HARP member. So we've got a number of responses back from most CMAs that have members that are affiliated with UHC. There's a couple remaining that we're waiting on. I just wanted to remind folks, if you could respond, if you were reached out to, Taylor had reached out to your organization. If you could get that in by this Friday, we have to get back to UHC by the beginning of next month with those responses. So we do appreciate you getting that information to us, and we can get that to them. So thank you for that. If you have any issues or questions, please reach out and we'll work with you on that. And then the next thing was just a quick reminder, quality notebook, any level 1 action items. Make sure that you're responding back to the health home through the health home email at the time that's been given on the response for the quality notebook when it's sent out. Most have been very good about that since the new policy has been implemented. So we do appreciate that effort, and we want to work with folks so that those level 1 items can be addressed and attended to before moving on to further follow-up. So please reach out if you're running into any issues, questions, concerns along the way. We want to work with you and partner to get those resolved. So ideally no one has a level 1 action item. So thanks again overall, and just a reminder that folks get those in through the health home email and the times that have been allotted. Thank you. Any questions with quality notebook stuff while I'm on this particular topic? Anybody have anything they wanted to mention, suggestions, concerns, comments, etc.? Okay. Well, we hope it's a useful tool for folks, and we're always willing to improve upon that. So please let us know if you have anything. Data Den, now that that's been rolled out, we just want to make sure that folks know that they can put recommendations in for any specialized reports you'd like to see built in Data Den. And we're in that phase now. We've been up and running for a couple months with the rollout to all the organizations, and as people are getting their feet wet in there and starting to get used to utilizing the quality tool, we want to make sure that we're getting reports in there that you may not see currently that you might find beneficial. So just shoot us a note through the health home email, and we will get that on the docket to look at and see if we can develop for you. We have a new sub-program category in the programs tab, and that's SMART, and it's a Health Home Plus step down. So we thought that would be useful for folks. We are looking to start running reports and data done on that once we start getting some data documented through NetSmart on it. So please, try and get that into your workflow. select that step down as the appropriate category for persons applicable. And you'll be able to start seeing some of that come out through reports. Taylor, is there anything else you wanted me to mention that I didn't around this particular topic?
Just make sure that you're ending the Health Home Plus program before you're putting the Health Home Plus step down program in. And like Travis said, once we get some members in that sub program, we'll be able to build that out in Data Den. And you guys will be able to see those members that are in that particular program, and it will come up on your contact summary as Health Home Plus step down instead of Health Home Plus. That way they can appropriately fall into the compliance or non-compliant for the appropriate number of contacts for that subpopulation.
Great. Thanks, Taylor. Any questions around this particular item?
Hi, it's Tina. I'm sorry if I missed this. The Health Home Plus step down, how long can somebody be in that step down program?
That's I believe that's a 6-month time frame, correct, Jessica?
Yeah, 6 months.
Thank you.
Yep. Any other questions around that step down category? Okay. And then just touching on the public health emergency, just action items that DOH has put forth. Everybody's been aware. I've had this up a couple months. We are in April. Just want to make sure folks are remembering that the plan of care and the comp assessments are now at the 60-day calendar timeline. We've always maintained that through the pandemic for 60 days. So that should be an easy one for us as a network. And then the other piece is around the consent component, verbal consent. We have to make sure that we're getting things written as we move forward. And then, just make sure it's collected through paper or electronically. Electronic is something that we can utilize that's come through. So, make sure you have that as an option if you don't already. It'd be another way to capture those signatures for folks. In-person multidisciplinary meetings are back to be in effect as of the April 1st date. So we just want to make sure folks are making sure you're getting that back into your workflow and, moving forward there. Any questions around this particular memorandum as far as the April 1st changes? I know we've been working as a network for quite better part of last year, really, just folks getting back to normal, quote unquote, in that sense, capturing signatures, getting them in the charts. We've been noticing that as we've been doing our comprehensive chart audits, our spot audits as a lead. So thank you all for all that work. I know it's been easier said than done in many instances, but we're at the point now where it's back into compliance policy wise that we have to make sure we're doing that. So I think we're a step ahead in many respects. So thank you all for all that work. And then I sent out a couple of weeks ago around the Health and Plus membership. OMH sent out a memorandum saying that effective August 1st, those flexibilities that were in place through the public health emergency will no longer be in play. Therefore, the 4 contacts for Health and Plus, 2 of which need to be face-to-face, will be back into effect as of that October 1st date. AOT folks are 4 core services are in person per month. So we have to make sure that that's occurring and face-to-face. And then folks with HIV, the 4 core services, 2 of the 4 must be in person. And 1 of the 2 must be with the care manager or coordinator. So we just want to make sure that folks are remembering that those things are going to be back in effect as of August 1st. Any questions around the unwinding public health emergency? May 11th, I believe, is the date still federally for that to officially withdraw. So we'll see if that holds. Hopefully it will. Got a question in the chat. Anyone who is already in step down should be changed over. Get back down here. to this new subcategory is the question. So yes, that's what we're asking in the programs tab. If Allison, if you could, end the Health on Plus program and then put them into the step down program itself. Does that answer your question? All right. Any other questions around public health emergency or anything that we've talked to up to this point? All right. So executive budget, still waiting. I believe the governor's just signed another extension so that state workers can get paid. This is, I believe, in the last 10 years, one of the longest, the most overdue budgets we've had. So that's not a good thing in that respect. Hopefully it comes through soon. But the director of Medicaid, Amir Basari, has vocally said in recent meetings that health home recalibration has definitely been in discussion, and discussions are actively happening around that. So there's still that push for anybody who hasn't or who would like to, again, send an advocacy note thanking Assembly and Senate membership for their advocacy to pull that out of the budget. To do that, while this is still pending. We're hopeful that it's going to come through soon. That's really it. We don't have much more information at this point. And that was it. Just wanted to point out that Shelters is now listed as an active provider in our network. Yay again, Shelters in Saratoga. Welcome. And then we have two other organizations currently that we're actively working with. Third, that'll be on this list shortly. So St. Joseph Rehabilitation and then People USA are currently going through the process of becoming a provider in the network. And then we have another organization that will be listed shortly as well. So we're continuing to expand the network, which we're excited about. And appreciate everything everybody's been doing in their work to support all the people out there in need of services. Anybody have anything they want to talk about? Any questions, clarifications, anything for us what we have today? Again, it's a shorter meeting for once, so that's nice. No? Okay. Well, thank you all again for everything you do each and every day, and I hope you have a good afternoon. And if you need anything, please reach out. Take care, everyone.